In today's video, we'll be going over the basic structures of the heart and blood pressure. The heart can be divided into four main chambers. There are two atria on top and two ventricles on the bottom. Separating these chambers are valves, which help prevent backflow of blood as blood is flowing through the heart. So, deoxygenated blood will enter through the superior and inferior vena cava into the right atrium. It will then pass into the right ventricle, passing through the tricuspid valve. From there, it will be pumped into the pulmonary arteries, where it will then go into the lungs to get oxygenated. After being oxygenated in the lungs, it will come back through the pulmonary veins into the left atrium, where it will then pass into the left ventricle through the mitral valve before being pumped into the aorta through the aortic valve, where it will then oxygenate all the bodily tissues. Now, one thing to note here is that the pulmonary arteries are carrying deoxygenated blood and the pulmonary veins are carrying oxygenated blood. A common misconception is that all arteries carry oxygenated blood and all veins carry deoxygenated blood, but that is not the case in all circumstances, with the pulmonary veins and arteries being one of them. Now, you may have heard or will hear the heart valves be referred to as something else. There are two main categories. We have the semilunar valves and the atrioventricular valves. The semilunar valves control the blood flow from the ventricles to the blood vessels. So in the previous diagram, this would be the pulmonary valve and the aortic valve. And then the atrioventricular valves, as the name implies, controls blood flow between the atria and the ventricles. So the two we have are the tricuspid valve and the mitral valve. The mitral valve is also called the bicuspid valve. That's because it has two leaflets, as we can see in this diagram. So like two flaps opening, whereas the pulmonary, aortic, and tricuspid valve all have three. Now, another way to remember the mitral valve only has two leaflets or flaps is we think of where the mitral valve name came from. It got its name from the mitre, which is this headwear that Roman Catholic bishops would wear. And as you can see, it resembles the two leaflets. So relating this back to clinical medicine, if you ever heard the term valve stenosis, this is a condition where a heart valve narrows and reduces or blocks blood flow. This can be caused by many reasons. One of them is calcium buildup over time with age, congenital defects, which means they were born with it, and some diseases such as rheumatic fever can cause mitral valve stenosis. So what does this actually look like? If we see in this example of an aorta, the aortic valve, on the left is a healthy one. It's nice and open or patent, and on the right it's stenotic or slightly closed, which is reducing or blocking blood flow. So just to recap, blood flow through the heart. Deoxygenated blood will come into the right atrium through the superior and inferior vena cava, move its way to the right ventricle through the tricuspid valve. From the right ventricle, it will go to the pulmonary arteries via the pulmonary valve, where it will then go to the lungs to be oxygenated, come back into the heart through the pulmonary veins into the left atrium, move its way down to the left ventricle through the mitral or bicuspid valve, and then from the left ventricle, it will be pumped into the aorta through the aortic valve, where it can then go and oxygenate the rest of the body. Now, blood pressure. This is simply the force of blood against the walls of arteries. If you've ever seen a normal blood pressure reading, you'll probably have noticed two blood pressures. The top number is the systolic blood pressure, which is the pressure when the ventricle is contracting and blood is actually being pumped out into the body, whereas the diastolic pressure is the pressure when the ventricles are relaxed and filling with blood in preparation to be pumped again. So if we look at this electrocardiogram rhythm strip, which is just an electrical tracing of the heart, the systolic blood pressure represented by the S would be the pressure when it's contracting, and the diastolic pressure represented by D would be the pressure when the heart is relaxed. And then a normal blood pressure is typically 120/80, and then the mmHg is just the units we use, which is millimeters of mercury.